Hello, everyone. My name is Benjamin Day. I'm the Executive Director at Healthcare Now. Thanks so much for joining us for this webinar, which we're going to be looking at the ColoradoCare Amendment number 69, and we'll be hearing from the folks who are organizing this on the ground in Colorado. It's really been an extraordinary year for our movement to try and win healthcare as a human right. We saw probably the first large-scale presidential campaign run on this issue. And I think partly we see that Bernie Sanders raised this issue and really highlighted it. But I think we should also credit the social movement work that went into making that a possibility for a candidate to run on. We have a strong majority of support in the United States for making healthcare as a right and providing it as a public good instead of a commodity. That's about 60% of the population, 81% of Democrats. The only thing that is holding this back right now is a democracy gap in our political system and money as well. And I think many of us looking at the state of Congress these days think it's very likely that one state is going to lead the way first, which is how they got universal health care in Canada, for example. Saskatchewan passed it first, and then other provinces followed suit, and then there was a national bill eventually that sort of codified it into law for everyone. So all of us around the country have our eyes now on Colorado. We're super excited to learn more about this ballot initiative and to find out ways that we can help them win, because that probably is the pathway to victory for us. So I just want to thank very briefly. I'm going to moderate this, and then I'm going to mostly I'll be shutting up and listening to the folks from Colorado like the rest of you. But I first want to thank the National Healthcare for the Homeless Council, which is providing the webinar forum for us to use, and the tech staff over in the communications department, who are just awesome and are helping us set all this up. And I also want to thank, I'm going to move ahead to, I want to thank our sponsors. We have a number of organizations who are getting the word out and have invited their members to join this. Obviously, ColoradoCare YES and Healthcare Now are the lead sponsors on this, but also co-sponsoring Progressive Democrats of America, SPAN Ohio, Labor Campaign for Single-Payer Healthcare, Maine All Care, Healthcare for All Oregon, Illinois Single-Payer Coalition, and others as well. So thanks to all of you for joining us. I'm just going to make a couple of technical notes. The ColoradoCare folks are going to give a presentation for about 30 to 40 minutes, and then we're going to switch to Q&A. But you can enter your questions at any time you want to into that Q&A box at the bottom. And it may be that if the presenters see something that's very timely, they'll address it in the middle. But any questions that they don't get to, we will hold for the end. And I'll just sort of collect the questions and try and combine duplicate questions. And then I will ask the questions of the ColoradoCare folks so that they can answer them for you. If you have any tech issues, you can see in the Q&A box that there's a number to call. You can call Alyssa at the National Healthcare for the Homeless Council, 615-226-2292. And a recording of this will go up on YouTube afterwards. So thank you so much, and I think we're going to get started. So we'll start off by kicking this off to Dave Sabinas.
Hi, everyone. Thanks for taking the time today. We're incredibly excited to be talking with all of you from across the country today. Again, my name is Dave Sabinas. I'm the General Consultant for Amendment 69, which we call ColoradoCare. And I wanted to start off just talking a little bit about some of the questions that we get when talking to a national audience, such as why Colorado and how does this actually work when you're not going through a state legislature to get on the ballot. Colorado is one of about 18 states that allows citizens to directly put constitutional changes of this type on the ballot. The way we do that in our state is collecting, this year the threshold was 98,000 and change valid signatures. And last year the campaign turned in nearly 160,000 from across the state. To put that in some context, we'll have probably a half dozen ballot initiatives or maybe a little more on this year, and the rest of them are actually just turning in signatures right now. And we've been on the ballot and actively campaigning for about a solid 9 months ahead of the rest of the ballot initiatives. We thought that was incredibly crucial, in part because we know as simple as we can make healthcare, it can still be sometimes a complicated issue for people to think about, and we wanted to have a as long of a time as possible to be able to campaign. For those of you who aren't familiar with our state, Colorado certainly has a history of being ahead of the national curve. Sometimes we also tend to ignore what nationals asking of us. And, our state has, been the first to legalize marijuana. We've been fighting battles for LGBTQ rights for years on the ballot, and otherwise, our voters are pretty accustomed to seeing major changes directly on the ballot in front of them. I know those of you who are from California and some other western states, this is an incredibly familiar conversation, but I wanted to bring it up for folks who are from some other states that are not quite as familiar. And of course, as Ben said, the state-by-state approach, that if we're able to succeed here this November with all of your help, then this will show not just the theoretical support for universal health care, but the actual support at the ballot box from a group of voters. And we know that we can help spread this to a number of other states after we're successful in November. So again, here's just a few of the numbers. We turned in quite a bit over what was required. And those of you looking at the presentation, you'll see Dr. Irene Aguilar there on the right. You'll be hearing from her in a few minutes. This was us turning in the signatures last year. Also, one of the questions we get often is what sort of thresholds are needed for success. Currently in Colorado, in order to win on the ballot, it's a simple majority, just a 50% plus one. That's all we need this November. I know some other states have higher thresholds for citizen-initiated ballot efforts, but currently Colorado does not. And again, Colorado voters in large part are very open to directly thinking about ballot initiatives in addition to our elected officials. Once again, I know we became fairly famous for our marijuana legalization. I know some other states were doing similar efforts at the same time. And one of the reasons I talk about this from a political sense, obviously these are dramatically different issues and dramatically different topics. But sometimes we're asked about, why is there not more of that kind of institutional support? And when Amendment 64, which legalized marijuana, passed, I would like to point out that 98% of our state legislature did not support it. We have a 100-person legislature. Literally, there was one Democrat and one Republican who supported legalization. The governor was opposed. The major city mayors were opposed. And voters still made up their own minds, and it got more votes than the president. We're actually in a significantly stronger political position, I think, than some of those efforts, but certainly not a full-fledged commitment from all of our elected leadership. And just a note, in the past few years, we also passed votes opposing Citizens United, actually opposing making it harder to do what we're doing. There were some efforts to restrict ballot access, and voters have generally opposed that as well. We're incredibly excited that our state party platform for the Democratic Party includes support for Amendment 69 by name. And of course, those of you who may have been at the DNC or read reports noticed that support for state-based universal health care systems actually made it into the national platform in Philadelphia. And so we're incredibly excited to be part of this national conversation this year. So at this point, I'd like to hand this over to Senator Jeannie Nicholson, who served in the Colorado legislature for many years, and we'll be walking you through kind of the key features of how Amendment 69 will work. Thanks.
Hello, everyone. This is Jeannie Nicholson. We're excited about the key features of ColoradoCare Amendment 69 because we know these are the features that the people of Colorado care about in terms of paying for their health care. Probably the for-profit health insurance companies don't care about these key features, but that's not who our audience is. So we have looked carefully at what we think is important for us to have as key features, and I'm going to go through each one of those. First, every Coloradan will have excellent, affordable health care. Every Coloradan, because we're not just talking about citizens, we're talking about all Colorado residents. Affordable, because we are going to use a premium tax based on ability to pay, like Medicare and Social Security, and excellent because we're talking about Platinum Plus coverage, everyone having excellent health care. We're going to use a cooperative business model. That means Coloradans will own ColoradoCare. It will be nonprofit, and we will allow 2 years to create the infrastructure with a very, very modest premium tax to fund that initial phase for the infrastructure, and then a higher premium tax when we go into the full implementation stage. Because we're going to use this cooperative business model, we know that we'll be able to avoid some of the significant legislative oversight and lobbyist interference that could derail the efforts of this particular effort to fund affordable health care in the state. It will be governed by a board of trustees, initially a 15-member appointed board of trustees, and ultimately a 21-member board of trustees elected from 7 geographic regions of the state. They will be accountable directly to Colorado residents. It will be a transparent process where the meetings will be open and posted. Annual audits will be posted on the website, and there'll be opportunity to appeal a board decision, very different than when the decisions are made by a private for-profit health insurance industry. And so we know that the people of Colorado will love this new way of governing our way of paying for health care. The funding, once we're fully implemented, will be a premium tax, 10% split between the employee and the employer. So the employee will pay 3 1/3%, the employer 6 2/3%, unless the employer wants to pay the full 10%, which they can choose to do so. Non-payroll tax will be equal to or less than 10% depending on tax bracket and exemptions. And we will also rely on an Affordable Care Act subsidy and the Medicaid funding. The premium tax increase can only be increased by a vote of the people. Colorado residents will have an opportunity to vote on premium tax increase above the 10%, no more often than once a year. If for some reason the Board of Trustees and the people of Colorado perceive that higher tax is needed in order to provide coverage, but we're confident for the first several years for sure that this 10% will be adequate. We will rely on federal waivers, the 1332 waiver and the Medicaid waiver. And ColoradoCare Amendment 69 will wrap around Medicare and TRICARE, meaning that Medicare and TRICARE will still, of course, exist as federal payment sources. ColoradoCare will act as a supplement to those particular funding sources for some of our residents in Colorado. And also, ColoradoCare will fold in Medicaid and CHIP, eliminating some significant administrative costs that are associated with silos. And I want to add, too, what's not on your screen, that we will also fold in the medical portion of workers' compensation and the medical portion of car insurance, so that we're eliminating those silos as well. Of course, we want to respect the healthcare providers. We think they are the good guys. In fact, Cinder Aguilar is a physician, I'm a nurse, and we would always want to advocate for our healthcare providers. And we will do so with reasonable reimbursement rates and providing far less hassle and administrative costs for our providers, and this will help avoid the desire for them to leave the state and attract providers indeed to Colorado from other states, and they will be paid the same amount, except perhaps some potential flexibility for some underserved areas of the state. I would just comment also that we have learned historically from Saskatchewan that there was a fear that providers would leave their state, their province, and go to other provinces when they started universal health care in the 1940s in Saskatchewan. Actually, the opposite happened. The providers came to Saskatchewan because they loved the idea that they would be paid no matter who the patient was, and indeed they would be paid money rather than zucchinis or chickens like sometimes physicians in the past were paid. And indeed the people who were ill, there was a fear that they would come from other provinces to Saskatchewan, but the truth is that they did not migrate to Saskatchewan. They just insisted on the same good coverage for their own province. And finally, I would just say that this is going to be protected by the Constitution in Colorado. That provides long-term assurance because health care, in our opinion, should be a right. It should be a public resource like public education and public libraries. And when it's in the Constitution, it avoids some of the legislative and or lobbyist interference in what we believe is a basic right.
Hi, this is Dave again. Hopefully that helps give a little bit of the overview of how ColoradoCare would work. Wanted to talk next a little bit about how we present the program to the public. And I wanted to say that for the folks writing in questions, we see your questions coming in. I think there's a few of them we address during the presentation, and all of them we will make sure to be addressing at the end if we don't answer your specific question in the meantime. So please feel free to keep sending them on in. One of the big questions we get certainly is how we talk about ColoradoCare. And one of the questions is, do we say single payer, universal, Medicare for all? We often talk about a Medicare for all type system. There's a few reasons for this. One is certainly Medicare is an incredibly popular program. Most people either have a family member or a friend who's been on Medicare, and even amongst people who are on Medicare, the system is generally seen as very good, very reasonable, very easy to navigate in comparison to private insurance. And so we're able to link the idea of universal health care to something that's already familiar to most voters when we refer to a Medicare for all type system. And it's something that, for those of you who are looking at proposals like this in your own states, would definitely encourage you to kind of look at the language you're using, because it's something that we definitely made a shift away. Technically speaking, there's also some reasons we don't use single payer because of being a state-based system and drawing in funds from multiple sources. It operates slightly differently. It's sometimes seen as a distinction without a difference, but it is something that definitely we don't really use the phrase single payer much in reference to our efforts, and either use universal if kind of the grammar requires us to, or refer to ColoradoCare as a Medicare for all type system when we can. One of the other things is, we address the tax increase pretty head-on. Not least in Colorado, in order to have this on the ballot, the language has to read that, shall taxes be raised by $25 billion, which on its surface, of course, you might imagine there's some sticker shock. And this is a payroll tax, to be clear. So this is drawn out of people's paychecks directly. And so we have a number of tools, some of which are online, and we have our website again on screen at the end, but it's just coloradocare.org. You can see we have some online calculators where people can go on and directly input how much money they're spending on health insurance and healthcare costs now, and how much they'd be spending if Amendment 69 passed. And we know that at least 80% of Coloradans are going to be paying less And we imagine it'll be very similar numbers to that in most other states around the country. And so helping voters understand, when a tax increase is not actually a cost increase is a large part of how we talk about Amendment 69. And the last thing, which is kind of the opposite of that, is making this personal. We are always collecting stories from folks who have, just these terrible experiences with the health insurance industry. Most of us who are on the campaign have had them ourselves, and that's why we're involved. And so when we start talking about why a change is needed, I know most people on this line probably, it's not even a question. It's understanding absolutely a change needed. But when we're going out and talking to the general public who might say, well, I had some problems, but I'm not too sure, really talking about some of the stories from folks who, some of the stories from folks who have had larger problems can actually be incredibly helpful. A little bit about how we're doing that. Like I said, we started very early. We've been actively campaigning for about 9 months, and a large part of that has been an aggressive earned media campaign. Every day, somewhere in the state, there's some positive press running about our campaign, and that's not because we have a significantly more amazing press corps than other states. It's because we have a communications team dedicated to collecting letters to the editors, getting in op-eds, pitching stories to reporters continually. And we tie that with the second point, which is the Speakers Bureau. Our Speakers Bureau has been traveling around the state. It's the term we've given to the two legislators that you're hearing from today, some other medical professionals and others who are speaking at debates, at town halls, Rotary clubs, moose lodges, as I put it, other woodland animal gatherings, elks, moose, etc. And that the effort from the campaign to not have to pay for every news article that we get in ads, but instead getting all of those stories in local press for free has been a large part of what we're doing. Over the summer, of course, we've also been shifting into what people often think of as the campaign. We're out knocking on doors, phone banking, and otherwise engaging directly with voters. The other question I get a lot is, the simple, well, can you actually win? And the answer is definitely yes. So our own internal polling showed a very interesting demographic in support. It shouldn't be too much surprise, I think, to a lot of folks on this call that a lot of younger voters are more inclined to support a system like ColoradoCare. And we also saw the strongest demographic that always votes. Seniors are always your most reliable voters. They're also one of our strongest demographics. And that shows a really interesting alliance that a lot of campaigns aren't able to pull together between younger and older voters. We also see Latinos as one of our strongest persuasion groups. Colorado is a state, for those who aren't familiar, with a large Latino population and with a very large young population. We're a highly desirable state, as I'm continually told, for folks to move here. And it's not just our internal numbers. There was about a month ago, a Denver Business Journal article that came out that had some polling from a company called Magellan, which is actually a more conservative polling firm that was likely done on the behest of another organization. It was not our own. And it showed that what we were seeing on our internal numbers was incredibly accurate. Again, younger voters being a strength, older voters, the swing voters we were seeing. And I have to note that ColoradoCare's internal polling was not publicly released because it's important to know that when these independent polls started coming out, they were done without that bias of knowing what our own internal numbers were showing. But they were actually reflecting very similar numbers to what we were seeing ourselves. The last thing I'll say is, on this note here, is that the framing really does matter. I talked about why we use Medicare for all or universal as opposed to single payer, but at the same time, when polls come out and say, do you want a government-run healthcare plan that takes away your ability to blah, 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 obviously that's going to poll pretty negatively. When a pretty unbiased poll comes out and talks about what our plan is versus the current system, it polls very favorably. And so if you're following us in the press and see some articles about polling around us, just take a look at how they worded the questions, because certainly there's some good ones floating out there, and there's a few that are essentially, push polls that were done with very negative messaging that were released as well that don't show as good of numbers. So that about wraps up this section, and I'm going to be handing the line over to State Senator and Dr. Irene Aguilar, who's going to be talking a little bit about our opposition.
Thank you, Dave, and thanks for that presentation. Hi, I'm Senator Irene Aguilar. As some of you may or may not know, I was a primary care doc for 23 years before joining the legislature, and now I'm focused on ensuring that everyone in the country has access to health care and hoping to get that way by making it happen in Colorado, a very purple state on the map. I wanted to tell you a little bit about our opposition. There are two groups, one of whom would not surprise you and the other of whom may. The first group is on the bottom right, where it says single-payer health care government takeover. That actually is Americans for Prosperity, and for those of you who may not know, they are funded by the Koch brothers. They have taken an active role in our state. In fact, our Senate president thanked them for getting our Senate into Republican control for the first time in 14 years, 2 years ago. And they have a campaign up and a website up against ColoradoCare. The second group is a little bit more surprising in terms of who the faces are, but not where the money comes from, and that's Coloradans for Coloradans. And as you can see, no surprise, most of the money comes from the health insurance industry. They've raised about $3.7 million so far. I think they keep waiting to see whether our campaign continues to make ground and move forward. We were told by an inside source that they had done another poll recently that indicated that we are gaining and not losing with the electorate, and hopefully that is correct. But I think that means that their next report will show a market increase in donations. Top right shows that part of this group, to many people's surprise, is our former Democratic Governor Bill Ritter, who is using the line that a lot of these groups are using now, which is that, yes, we support universal health care and Medicare for all, but it needs to happen at a national level. It can't happen at a state level. And as we all know, at the national level, what we're getting are 61 votes to repeal the Affordable Care Act and not one vote to improve the Affordable Care Act. And even at the state level, in terms of doing things to improve on the Affordable Care Act, we get lots of resistance because one man's savings is another man's cost. And the health insurance industry has many paid lobbyists who make sure that their interests are not thwarted when new laws are passed. And so that is the group Coloradans for Coloradans running the No on 69 campaign. The unexpected opposition we've gotten is actually from our Democratic House folks. I serve in the Senate, and we had a number of discussions about Amendment 69 while we were in the legislative session, in which I frankly had encouraged legislators to be neutral on the amendment and to not take a position. And my rationale for that was that I knew that the Republicans would want to make this a Democrat-Republican issue and that there would be no Republicans who would take the time to sit down, read through, and think through the impacts of Amendment 69 on the state of Colorado, but there would be a bunch who would blindly sign on as being opposed. And so I didn't want this campaign to become mixed with the toxic politics of Washington where Democrats are supporting health care improvement and Republicans are opposing. Unfortunately, our House Majority Party sent out an email to their candidates telling them that it would be okay if they wanted to be no on Amendment 69. The interesting thing is this article that you see referenced here shows that that came as a result of input by a lobby firm that works at the Capitol. This lobby firm, not surprisingly, also works for pharma. And so that is, I would say, our unexpected opposition. And that's about what we're seeing right now. What's fascinating for me is that in Colorado, most of our conservative areas are in our rural districts. And if you've not read about us in the newspaper, you'll know that actually our highest insurance rates are in our rural and mountain communities. And these communities have not seen the economic return that the rest of Denver and the Front Range has seen with our economic recovery. And so we literally have mountain areas where their rates are 23% higher than rates in the Denver metro area. And so we get a very favorable reception talking to conservatives in these districts because they are experiencing the pain of our dysfunctional healthcare system on a day-to-day basis.
Hi, this is Dave Savedos again. And before I get to this very last slide, I wanted to take just a minute to circle back to something I said on kind of how we present universal health care and our Speakers Bureau and our messengers in a way. All of you have now heard from both Senator Jeannie Nicholson and Senator Irene Aguilar, who, in addition to being wonderful Democratic legislators, are both from the medical community. And that really resonates a lot when we go out and talk about Amendment 69. It's not just, here's some politicians talking about something you should vote for, but Jeannie was a public health nurse for many years before entering public office, and Irene was, and still is, a medical doctor in Denver. And so both of them have that ability to really speak with authority. So as we've been building up, like I said, our speakers group, we've been finding more people who can do that. And I definitely encourage you all, as you're looking in your own states, when you're looking for who are some of the people who should be the head of your efforts, to find folks with that medical background, that community health background. And of course, our last spokesperson who unfortunately had a scheduling conflict and wasn't able to join us today is a name that some of you may know, T.R. Reid, who is a author and a former journalist at the national level, who's also a very respected surrogate for the campaign as he's been traveling around the state. So, but I wanted to close, before I hand this back to Ben and then we address some of the questions that we haven't yet, with how you all can help. We know, as Irene said, we're up against national opposition, and the Koch brothers, Americans for Prosperity, have been knocking on doors and putting out really scary-looking ads and otherwise campaigning against us actively for a number of months. And despite all of that, as she said, we're hearing more and more that we're actually gaining ground out here. But we know that when the full onslaught, if I can use that word, of corporate national money that's going to be coming in does take effect, we're going to be pretty outgunned ourselves if we're not able to get more help from the national scene. And that's where we're asking all of you today to pitch in and do what you can. The first is, for those of you who are with organizations, large or small out there, help us reach out to your lists. We'll be able to talk to your folks about ColoradoCare, and generally that is a pitch to help financially, and whether those lists are shared to us fully or you're sending out emails on our behalf asking for help, we definitely greatly appreciate whatever help you can give. The next is helping us identify people to come out to Colorado and speak. We know every state has those local celebrities, and like I said, we're fortunate someone like T.R. Reid lives in Colorado, and we know there's folks like him in many of your states. And if you have some of those healthcare giants who want to come spend a week or even just a weekend in beautiful Colorado, we're happy to help them find a place to stay and have some great opportunities for them to speak and get some press out here. The next is, directly helping talk to voters. We're getting a lot of volunteers in from around the country who are asking, how can I help without leaving where I'm at? And we are now setting up the technology for more sophisticated kind of virtual phone banking opportunities for people. They can just log in on a computer and call voters out here and ask for their support. And if you want to take one step above that, like I said, consider coming out here yourself. I always like to make the pitch that not only are we a truly beautiful state and have wonderful things to do while you're out here, but of course you get to be on the ground to help pass the first state's true universal health care. And lastly, if talking to voters directly isn't your thing, please do follow us on Facebook and other social media. We have an incredibly active profile on there and are campaigning digitally pretty nonstop, and it's definitely been one of our strengths. So please follow us, share what you see there on social media, invite friends and family in Colorado and around the state to follow us on social media. That certainly helps as well. And the last thing, of course, would just be to sign up on our email list and encourage others to do the same. And if you're about to ask how you can do any of those things, I'm going to leave this up here for a few minutes. This is our web address, coloradocare.org. All of the information, including some more details on the planner on there, and information about how to volunteer. There's volunteer sign-ups. You can get plugged in directly. Those go to our field team, who will be responding back to you shortly. And, of course, you can also make a contribution securely online there as well. So thank you so much, everyone, for who's been part of this. I'm going to be handing it back to Ben now, who's wanted to say a few more words, and we're going to start taking a look at some of these questions you all are sending in as well. Ben?
Great, thanks. Thanks so much for the presentation. I've been sort of tracking everyone's questions. We have about 100 people on the line, so welcome to everyone. You have been sending in some phenomenal questions, and I'm just trying to organize them a bit. So I think we'll just spend some quality time on Q&A, and then we'll do a quick wrap-up. But, you know, this really is sort of the moral imperative of our time, so I'm really I'm so enthusiastic to see the campaign work and to hear the questions that folks are putting in. So I've sort of sorted the questions into a few categories. Some people are asking about how the policy works and how you message around it. Some are asking about the organizing side, and some people are asking about the financing of the bill. So I think I'm going to start with the policy questions I have here, and feel free to keep submitting questions, and I will catch up with them as you send them in. One good question was from Marge, and she wanted to ask how this legislation defines residents, i.e. who is actually qualified for receiving the benefits. And does it include all immigrants, and does it include the homeless who might have a difficult time establishing residency?
Thank you for your question. And yes, it does include everyone who has established residency in the state. We anticipate, because a large portion of the funding is through a Medicaid waiver, that people who are Medicaid eligible become eligible immediately. In terms of people who move to the state, the Board of Directors is given the authority to determine how residency is defined. The attorney who worked with us on this policy states that there are some legal precedents for how this happens. It's our intention, however, and in writing it, we drafted the language to include all immigrants to the state who are from other countries and may not be documented.
Great, thank you. Another good question here was whether, this is from Jim, whether this would require, whether the legislature would need to act on enabling legislation. I guess there's a state legislature. Do you need federal approval? What are the sort of existing barriers if the ballot initiative passes to actually making this reality?
Thank you. And yes, the amendment specifically refers to the legislature needing to pass enabling legislation. Part of the reason for that is in order to apply for a waiver from the Affordable Care Act and from Medicaid, you need enabling legislation from the legislature. And this is part of why we also put this in our Constitution, is that we've seen with the experience of legalized marijuana that whether the legislature agrees with the policy or not, if it is in our Constitution, they hold true to the requirements of the language.
Gotcha, thank you. Then there's a question from Joan about how do you talk about potential job displacement, like the folks in the insurance industry who might potentially lose their jobs from this passing?
I think it depends on the audience.
Mm-hmm.
So for one thing, I actually had written to our Department of Labor to ask how many people were employed in the insurance industry, and interestingly, only 4,400 people met that metric. Now, my guess is that none of those are people who actually work in providers' offices dealing with billing. And so I start with that fact. I add on that we know that a number of our insurers are actually based out of state and frequently have call centers that are even based out of the country. And so we don't have a clear number of what the numbers of people are that are displaced. I then will reference a study that was done out of Northern California, when they had been running their single-payer legislation. There was a study published about what the impact would be on jobs, and what it found was that while jobs in the insurance industry would be lost, there would actually be a total increase in jobs, both within the healthcare sector and also in other fields because of freeing up of the gross state product in the economy to do other things. And so we addressed that as well.
Yeah, I know that was found in Vermont and a lot of other states that have looked at job impact as well. So there's a question from a guest about the impact on hospital consolidation, but maybe I'll just broaden this question. If you could say a few words about how would it impact just the delivery system and providers in general? Would it be totally unchanged, or what would happen there with these, huge merged hospital chains?
So a couple of things. First of all, we are seeing a lot of mergers in our hospitals here in Colorado, and most of these, many of these hospitals are also building out new facilities to try and increase their negotiating power. I'm going to try and unplug that phone. I'm so sorry. And but what's interesting, and what I usually quote in talking about hospitals, is that there was an article by Atul Gawande which talked about how in the Netherlands they refocused their efforts around healthcare on the high-cost patient population, and actually ended up going from needing 150 hospitals to needing only 70, and we're anticipated to go down to 45. And so I would anticipate we'd see closure of some hospitals because in our state, and I don't know what's happening in other states, we've had an overbuilding of hospitals, and they're doing this primarily to get market power with the insurers, which drives up costs. And we'd like to instead see an overbuilding of patient-centered medical homes and medical practices focused on taking care of the high-cost patient, because that's where a lot of the savings in healthcare can come in the future, is by ensuring those people who have chronic diseases or serious diseases are getting timely access to the full spectrum of care that they need.
Great, and sorry for the rapid-fire questions here, but we have a lot of really good ones. And just a number of people asked if the slideshow will be available later, and we will. We'll have a YouTube up of the entire presentation. I assume we can put the slides up as well, and we can also publish the questions and the answers in sort of written form, which I think there's already an FAQ on the ColoradoCare site, but we can also sort of put the Q&A here up afterwards so folks can easily find it later. So I think I'm going to move to some of the questions about organizing right now, and we'll come back to some other policy questions later. So there's a question from Hank about was there and is there a coalition behind this, the ColoradoCare campaign, and who's sort of involved in it? Who are the key players?
Sure. This is Dave Svetos again. We're really proud to be endorsed by the League of Women Voters, Together Colorado, which is a local civic and somewhat religious faith-based organization. Obviously, Healthcare for All Colorado, which I know has kind of linked affiliates in a number of states, and a number of organizations of that ilk are all on board. I'm not sure if that answers the question fully.
That's all I had for the question, so hopefully.
Okay. Hopefully. And if not, feel free to chime in with it again, and we can answer it better.
Okay, got you. There was a guest who had a question about why did we see this split amongst Democrats in Colorado? Do you have a sort of a sense of why that went down the way it did?
Yeah, we actually had, we have the same anti-establishment issue within our Democratic Party that existed, I think, with the Hillary-Bernie split. As you might have noticed, our state actually went 65-35 for Bernie in the Democratic Party. But if you were to look at legislators who came out publicly, it probably went 80-20 for Hillary. And so I think some of this is a continuation of that split that exists. And there's been a concern by the people who run the Democratic Party at the state level that having this issue on the ballot may in fact lead to Democratic candidates losing support from independents. Colorado is split pretty evenly, 30-30-30, Dem, Republican, Independent, and they are actually concerned that this could cause loss of votes. This has never been shown or proven, and we counter saying that we're concerned they're going to lose the 30% active Dems who voted predominantly for Bernie if they don't have some progressive issues on the ballot for which to come out. But that's it's tied in the same as national politics with the people who are more establishment, whereas compared to the people who are more tied to what the true values and platform of the Democratic Party are.
Interesting. And that's a great segue to a question that Michael had, which is, as far as you know, will Bernie get involved with this campaign effort in any way?
We certainly hope so. I'll just say we've been in conversations with a lot of his folks, and I know some of our team had a chance to talk to them directly when we were all in Philadelphia. And so I certainly don't want to put words in the senator's mouth. I'll just say that they're certainly aware of what we're doing and seem friendly, and we're talking a lot right now. So.
Great. And this is a question from Terry. It's related to the coalition question, I think, which is he was wondering how the State Medical Association has weighed in on this in Colorado. I think we have one medical association in the country in Hawaii that has actively endorsed single-payer health care or universal publicly financed health care. What happened in Colorado with the official doctors organization?
So our biggest organization is the Colorado Medical Society, and they actually started by getting together a stakeholder group to discuss the pros and cons of Amendment 69. They were supposed to just do a dispassionate analysis on the policy. It ended up coming out as two separate papers, one of what one group thought were the pros of Amendment 69, what the other thought were the cons. They just this week put out a survey to their members to get a sense of where their membership is on the initiative. Up till now, they've been officially neutral, evaluating it, and I think what I've heard is they will announce the results at their annual meeting the weekend of September 16th. That first evening of their annual meeting, they actually are hosting a debate at which I will be present. This is Dr. Senator Aguilar presenting for the pros, and a woman named Cody Belsley will be presenting for the opposition. So they have tried to stay very objective. What I hear through providers is that you have a niche of people who are very supportive, a niche of people who are adamantly opposed, and a lot of people who aren't sure what they think.
Great. So there's a question from Dennis about the attack from the Koch brothers. How are you all responding to that, and is there a way to sort of turn that to your advantage given the sort of national dislike of the Koch brothers and their involvement in politics?
Absolutely. I think they're the family everyone loves to hate, at least for those of us on the left. And, I should add that, certainly the Kochs aren't just here, going after us. We have a top targeted federal Senate race, two top targeted federal congressional races, and control of the state legislature on the Senate side is currently by 1 seat, and the House is by a few seats. So there is a lot of pushback from whether it's the Democratic Party or some of these other candidates really going after Americans for Prosperity and the dark money that they're spending in our state. And so, we've really, I think, been able to paint them as our key opposition, which in large part is true. While they don't disclose their donors for some interesting federal reasons, they found some loopholes. You know, we've been able to kind of estimate some of what they're spending, and putting that number out very publicly has, I think, opened the eyes of a lot of voters of how much money in politics really does impact, and just how truly terrible some of their tactics are. I would actually really encourage folks, you can kind of see the slideshow I know later, the video that Dr. Aguilar links to, the Americans Prosperity one, you can also just Google it if you're interested. Please go and watch it. I personally find it hilarious. It's the same kind of 1990s tire tactics of single-payer government takeover of your health care, the sky will fall, and you know, you'll never be able to see a doctor again sort of tactics. And I think most people are pretty past that at this point, and I think looking to find real solutions.
Mm-hmm. So I'm going to switch now to a few questions on financing, and we keep having questions coming in. I can already tell we're probably not going to get to all of them, at least before we run out of time on this call, but we can try and get to them by text and answering them online after the call. But I'm going to try to cover as much as we can. So there's a couple questions about how it was paid for. Chris was asking about the non-payroll part of the tax. What kind of income is that that's being taxed? And there's a question from Bill about do retirees contribute if this is mostly paid for out of a payroll tax? Could you guys offer a little bit of clarification on the financing part?
This is Senator Nicholson. To be clear about the tax for non-payroll, it is equal to or something less than 10%, depending on the tax bracket that someone is in. The estimate is that many people will fall in the 5.5 to 8.5 percentage area when they're contributing their taxes at the end of the year. But there are lots of variables to that, and one of the key points is to understand that it is taxable income. It is not all income, and the average person doesn't really even know what's taxable and what's not until they sit down and calculate it through their 1040 form with their CPA. But we're trying to make it easier for people to go to our ColoradoCare.org website and click on the calculator. And there's a calculator for businesses and a calculator for individuals so that people can actually put in their personal information, and it will calculate what their amount of tax will be, because we know that people want to know how this will affect them personally, not just in general, how this will improve the state, because we'll have universal care, and they can go directly to that. Then one other point to make about how this works is that there are a number of exemptions. They're not exemptions that are created specifically for this measure, but they're ones that exist for Colorado tax code and the IRS codes that provide exemptions for certain groups of people and certain portions of their income. For example, the estimate is that for people who are 65 years of age and older who are on Medicare, they'll be paying into the tax even though this will be secondary for them, but they will also have an exemption that means that they don't pay that full 10% of all of their taxable income. The first approximately 40% if you're filing individually, or the first 33,000 or the first 60,000 if you're filing jointly, is actually completely exempt of your Social Security and certain kinds of retirement funds. So, you know, it becomes complicated enough to explain how this will affect each individual that we feel passionately that the message has to be delivered. Go to the ColoradoCare website, click on the calculator, and calculate this for yourself, because people, when they do that, are delightfully surprised to find out how much this will save them and how much better their coverage will be.
Thanks. Let's see. We have a lot of other questions still coming in here. There's a question from Dan about shifting from the cost to individuals to the cost of businesses. Is this going to be, what is the impact on businesses? And he was particularly interested in businesses who do not currently provide health insurance. Is this going to be a cost increase for them, or what's the impact for the business community?
Sure. This is Dave again. So to start with, for businesses who do provide health insurance for their employees, the average rate they're paying is somewhere in the neighborhood of 14% of their payroll, depending a little bit on the size of the business. And we would be cutting that more than in half to that 6.67% of payroll. For businesses who are not providing health insurance now, we're creating an affordable option. And certainly, we're asking the Walmarts of the world to pay their share. Some of the larger corporations who keep employees at very part-time status so they don't have to provide benefits, we're going to be asking them to contribute that 6.67 so that their employees are covered and no longer relying on emergency rooms and other costs that are passed on to other consumers. For most small business owners we talk to, and I can say this from personal experience, I run a small consulting company in Colorado, and I have been unable to provide health insurance easily for my staff over the years because of the costs associated when you're only trying to you're only trying to cover 2 or 3 people at a time. That 6.67% of payroll is an incredibly affordable option, and probably less than a third of what I was finding on the marketplace when trying to do a small organization health insurance option.
Mm-hmm. All right. Well, we have about 3 minutes left and a lot of questions on the board, but I'm going to try and squeeze in 3 questions in 3 minutes. So it's going to be kind of a rapid-fire one. But there was 2 questions from Henry and Turi about how does the bill deal with long-term care? And I know that similar legislation around the country deals with long-term care very differently.
And actually, long-term care is only guaranteed under the current guarantee, so for people who are Medicaid eligible and at the same levels that Medicare delivers it.
Okay. And was there a particular reason for that, or?
Yes, the projections about what's going to happen to the United States health economy because of long-term care are daunting, and in fact, you can't find anyone selling long-term care insurance anymore in Colorado.
Wow. Then there was a quick question. There's a question from Dan about why, what was the reasoning behind having a sort of a separate governing board instead of a state agency? And a couple of people had questions related to that arrangement. Someone else was interested in, if it's not run by a state department, how do the waivers go through and all that? So could you say a quick word about the reasoning behind the co-op board?
The main reason is that we were hoping that by having a separate board that actually people who understood about healthcare would be elected. If you go to our state legislature, you'll find very few people who have any sense about how health insurance works or what the determinants of health are. And so one reason was for expertise. The second reason is Colorado actually has wings of it that are very anti-government. And we were trying to, as much as possible, make this outside of state government. The amendment specifies that our State Department of Healthcare Policy and Financing will need to apply for the waivers for ColoradoCare. So they are engaged and codified in the amendment to help ColoradoCare from that perspective.
Great. And so I'm going to have one final question here, and then we can sort of wrap things up. But I encourage people to, we'll do a little follow-up. When we post this, we'll make sure that we have somewhere where you can direct your questions to ColoradoCare, and we'll answer as many of them as we can that we couldn't get to on the call. So there was a question about having, a precinct-by-precinct strategy, working with, the Bernie campaign or with MoveOn.org. What is your can you say a few words about sort of the ground plan, the grassroots organizing effort between now and November?
Absolutely. This is Dave again. And between a combination, of course, of our polling, focus groups, and just what we've been seeing on the ground in the well over a year this campaign's been running since starting to collect petitions, we've definitely identified some areas of the state that have our best potential for persuadable voters, other areas where it's just a matter of making sure to turn out friendlies to make sure that we get as high a turnout as possible in some of our very liberal areas. And for people who are interested in doing phone calls or coming out and canvassing for us, we can definitely help match you up to an area that's probably not dissimilar to what part of the country you're from. We have targeted areas in our mountain communities, in the Front Range, and in the West Slope, southern Colorado. Definitely in every region of the state, we're picking apart where do we actually need to engage with voters, where do we just need to turn them out, and obviously in some cases where do we need to ignore. So I'll kind of spare the 20-minute conversation on our internal electoral map of the state, but certainly we've been doing that sort of research and are putting that into effect in our field plan.
Great. Well, I really want to thank so much all of you for joining us and for our presenters from ColoradoCare. This is tremendously helpful, and I know that as the year goes on, Healthcare Now, as well as Progressive Democrats of America, National Nurses United, some of our national allies will be working on organizing some national phone banking ways that we can provide solidarity support for y'all in Colorado. But for now, I think this is really helpful and educational, especially if folks are going to be making calls later in the year to sort of know what's going on. And we all have our own fights in our own states, and we're trying to learn from one another. So thanks again, and we will be following up by email with all of you. So thanks so much.
Thank you.
Thank you.
Take care, everyone.